Bansal. I am cardiologist at Kokilaben Dhirubhai Ambani Hospital, Indore. And today, the next some time we'll be discussing expert perspectives on English Raj. So, as we all know, Indians have higher CV risk and experience earlier CV events. Elevated LDL cholesterol levels are crucial due to their strong and linear association with ASCVD risk. Each 1 mole per liter, that is 39 milligrams per deciliter decrease in LDL, is associated with 21% reduction in major adverse cardiovascular events. So, this you can see there are so many trials which are witness to this reduction in cardiovascular risk associated with decrease in LDL cholesterol levels. Latest guidelines recommend to strike early, strike strong for intensive LDL cholesterol lowering to achieve targets in high-risk patients. Lower is better. If we look at 2023 ESC guidelines, CSI 2023 guidelines, LDL reduction to less than 55 in high-risk patients. In patients with a second CV event within 2 years, an LDL goal of less than 40 confers additional benefit. 2022 expert consensus decision pathway, clinical ASCVD at very high risk, LDL to less than 55 or to more than 50% reduction in LDL levels. If you look at 2023 Lipid Association of India consensus update, very high risk, CV risk, LDL less than 50. Then we have category A, LDL less than 50. Extreme CV risk category B, LDL to less than 30, and extreme CV risk category C, LDL reduction to 10 to 15 milligrams per deciliter. There is no significant association between very low levels of LDL cholesterol and safety outcomes. A secondary analysis from 4-year trial showed cardiovascular benefit showed cardiovascular benefit with further lowering of LDL cholesterol levels with no safety concerns even with LDL cholesterol below 10 milligrams per deciliter. So inclisiran is first in class siRNA therapy to lower LDL cholesterol. Inclisiran specifically works in the liver, mimics the body's process of RNA interference which is restricted to cytoplasm, conjugated for specific update of hepatocytes, low likelihood of off-target binding, inclisiran plasma levels decline within 24 hours and are undetectable within 48 hours. So, prevents the production of target protein, greater hepatic uptake of circulating LDL cholesterol, and reduction of LDL cholesterol in bloodstream. If we look at Indian approval, CDSCO approved indications, inclisiran is indicated adults with primary hypercholesterolemia, heterozygous FH, familial hypercholesterolemia, and non-familial hypercholesterolemia, or mixed dyslipidemia as an adjunct to diet, in combination with a statin or statin with other low lipid-lowering therapies in patients unable to achieve LDL cholesterol goals with a maximum tolerated dose of statin, or in combination with other lipid-lowering therapies in patients who are statin intolerant or for whom statin is contraindicated. Inclisiran suitable patient profile. Useful in high CV risk individuals with an atherosclerotic cardiovascular disease whose high LDL cholesterol levels remain inadequately controlled with standard lipid-lowering therapies such as statins, ezetimibe, or bempedoic acid. It is also useful in the treatment of heterozygous familial hypercholesterolemia. The recommended dose is 284 milligrams of inclisiran administered as a single subcutaneous injection initially, then at 3 months, and then after every 6 months. So it is a 1.5 ml solution per syringe, 300 milligram inclisiran sodium, water as a diluent, sodium hydroxide and phosphoric acid, pH of 7, stored at room temperature. Initial dose, second dose at 3 months, then every 6 monthly. Injection is subcutaneous in the abdomen by healthcare professionals. Missed dosage: if a planned dose is missed by less than 3 months, inclisiran should be administered and dosing continued according to patient's original schedule. If planned dose is missed by more than 3 months, then a new dosing schedule should be started. Inclisiran should be administered initially, then again at 3 months, and then every 6 months. Treatment transition from monoclonal antibody PCSK9 inhibitors. Inclisiran can be administered immediately after the last dose of monoclonal antibody PCSK9 inhibitor. To maintain LDL cholesterol lowering, it is recommended inclisiran is administered within 2 weeks after the last dose of monoclonal antibody PCSK9 inhibitor. So, if you look at the management of dyslipidemia, CSI guidelines 2023, Non-fasting lipid profile within 24 hours, 40 hour plus E oblique 80 atorvastatin plus ezetimibe, rosuvastatin 40 plus ezetimibe or 80 atorvastatin plus ezetimibe. Then LDL less than 55 or LDL more than 55. Then add bempedoic acid. Then again check. Then you can add PSK9 or you can LDL cholesterol less than 55, non-HDL less than 85. If the LDL cholesterol is less than 55. So management of dyslipidemia and ACS, non-fasting lipid profile, 40 rosuvastatin, 80 atorvastatin plus ezetimibe. Then we divide into LDL cholesterol less than 55 or LDL more than 55. Then we do lipid at 4 weeks. The CSI guidelines recommend that in patients with ACS, if an LDL cholesterol target of less than 55 is not achieved, ezetimibe, bempedoic acid, then other non-statin drug, PSK9 inhibitor or inclisiran can be administered. Then these are the nice guidelines. They maintain if maximum tolerated dose of statin does not control non-HDL or LDL cholesterol level well after 3 months, confirm statin adherence, then consider the following options. Then in the injectable therapies, we have inclisiran. So inclisiran finds place in the important NICE guidelines also. Then if you look at ACC expert consensus, inclisiran finds place in ACC expert consensus also. Phase 3 study details: Orion 9, Orion 10, Orion 11. The dosage was the same. Inclisiran sodium 300 mg or matching placebo administered subcutaneously. All these 3 trials were 18-month long trials which were completed. And inclisiran demonstrates an effective and sustained LDL cholesterol reduction with a low inter-individual variability. So with inclisiran as a strong complement to maximum tolerated statin, around 68% of patients achieved an LDL cholesterol less than 17, 52% achieved an LDL cholesterol less than 50. Inclisiran in Asian patients, Orion 18 patients with ASCVD or high risk of ASCVD, placebo adjusted mean percent reduction in LDL cholesterol baseline with inclisiran was 57.2%. Ratio of lipoprotein little to baseline levels were approximately 41% lower than with placebo at any day. Then inclisiran reduced levels of other atherogenic lipids and increased HDL cholesterol levels. So this diagram, this chart reflects change in lipid parameters at day 510 multiple imputation ITT population. Inclisiran was generally well tolerated with a safety profile similar to placebo apart from injection site reactions. Then treatment emergent adverse effects and serious adverse effects generally similar between inclisiran and placebo groups except for ISRs, and more participants experienced ISRs in the inclisiran group 2. Well tolerated proven safety up to 6.8 years of exposure. Orion 8, which is an open label extension trial of Orion 3, 9, 10, 11 of 3 to 7, 4 participants assessed long-term efficacy and safety of twice yearly inclisiran in patients with high cardiovascular risk and elevated LDL-C. Showed inclisiran could reduce LDL-C levels in the long term while being well tolerated. Inclisiran acts in the cytoplasm of hepatocytes and not in the nucleus, so there is no risk of carcinogenicity and immunogenicity. Results from Orion 8, the largest long-term safety and efficacy follow-up trial with inclisiran conducted to date, show inclisiran could reduce LDL cholesterol levels in the long term while being well tolerated. So, what were the results? 78.4% of patients achieved their pre-specified LDL cholesterol targets at the end of study. Approximately 90% of patients achieved their global lipid targets at any visit. On an average, LDL cholesterol levels are improved by approximately 50% of study. The mean exposure was 2.6 years. The Orion 4 and Victorian 2P are ongoing CVOTs with completion dates anticipated in 2026 and 27. While the results of CVOTs are ongoing, a recently published pooled patient level analysis of Orion 9 and 11 provided some insight into the possible cardiovascular benefits of treatment with inclisiran. Mendelian randomization studies with 20 million years of follow-up proven dose-dependent log linear association between the absolute magnitude of the exposure of the vasculature to LDL cholesterol and risk of ASCVD. Thank you so much for your kind participation.